Hi folks, Christian Brindle here, specializing in Medicare health plans. And today we're going to talk about when can you actually change your Medicare plan depending on which type of Medicare plan that you have. So let's just jump right into this. So typically in the Medicare world, you're going to be really concerning yourself with two different avenues and ways you can go with your plan. Although I'm going to be talking about three different kinds of plans today in this video. If you enjoy this video, by the way, at the end, make sure to drop a like on it. Drop your comments in the comment section on Medicare questions that you have most commonly. Make sure to hit the subscribe button so that way that you're notified when we upload our educational free Medicare information. And let's talk about Medicare plans. So we're going to talk about Medicare Advantage plans, number one, Medicare Supplement plans, number two, and Medicare Part D prescription drug plans, number three. These are the three typically Medicare-facing plans that you really have to be aware of and kind of what you need to pay attention to when it comes to changing your plan. So Medicare Advantage plans essentially are plans that essentially you run your Medicare through a private insurance company. That's an easy way to think of it. So this private insurance company is essentially taking over the responsibilities of paying your claims and issuing your Medicare. And that's going to be a private insurance company. There's a lot of different companies out there that offer them in a lot of different states. And so I would say with Medicare Advantage plans, one thing that you should be aware of and knowledgeable about is you can typically change these plans 2 times of the year. You have what's known as the annual election period, or AEP for short, and that's going to be from October 15th through December 7th. Now, Medicare Advantage plans change their benefits a little bit each year. They can change the price. They can change the benefits. They can change the medical benefits. They can change their prescription coverage. They can change their provider network. So these are things you have to be aware of with your Medicare Advantage plan. And so essentially, folks, what I would recommend to you is being aware of that and just understanding that that's the time period. Really, October 1st is when the changes are going to be announced. And you can make the changes from October 15th through December 7th for the upcoming year. Changes take effect in January. However, you can also change your plan between January 1st and March 31st currently in a time period that's called the open election period, essentially. Open enrollment period is what it's going to be, OEP for short. This is going to be a time period to which you can change your Medicare Advantage plan if maybe you made a change during open enrollment, or maybe you didn't make a change during open enrollment and you're just essentially needing to make that change, essentially. The other thing that you have to be aware of is Part D prescription drug plans. So these are essentially individual prescription plans, pharmaceutical plans that you pick up separately, just through an insurance company. They're just drug plans. D for drugs is an easy way to think of it. And they typically are designed to pair with a Medicare supplement. Those plans can typically only be changed during the annual election period, which is October 15th through December 7th. Now, if you qualify for a life-changing event, like let's say you moved out of your state or you have some kind of life-changing event that took place, you might qualify for a special enrollment period, but that's a topic for another day. Just keep that in mind that that's always in the cards if you might qualify for it. Now, Medicare supplement plans, on the other hand, those you can change any time of the year. They're actually month-to-month plans. The only criteria, though, to be able to change from one Medicare supplement plan to another is, I would say, you're looking at something, essentially, that it would be, you have to pass health questions and underwriting to be able to change from one Medicare supplement plan to another. That is the typical criteria, whereas Part D prescription drug plans and Medicare Advantage plans do not ask health questions of any kind at this time. Anyway, folks, I hope this answered your question. If you have any questions you'd like me to answer about the wonderful world of Medicare on this channel, please do us a favor, drop them in the comment section, let us know about it. Hope you enjoyed this video, and happy Medicare.